Hey everybody, welcome to another edition of the Columbus Medical Association's video blog series. I'm Dr. Nick Kman. I'm a attending physician at Ohio State. I'm a professor of emergency medicine at Ohio State, and I help with emergency preparedness and disaster response with Ohio Task Force 1, which is Ohio's urban search and rescue team. I think this is the 5th or 6th edition I've done of the COVID-19 preparedness series. Columbus Medical Association asked me to talk a little bit about bringing our kids back to school. And I've really wanted to do this one for a little while. It's taken me a lot longer to compile my thoughts on this. It's also a very personal issue, I think. So what I just wanted to start this with is saying that this is evidence-based. I think I did a deep dive into the medical literature to find every bit of evidence that I could to support an argument, one way or the other. I will say that this is not professional advice. This is my interpretation of the literature and how I'm internalizing it for my family. My daughter turns 11 tomorrow and my son is 8. And every parent has to make their own decision. But hopefully what this can do for you is give you some data that you can think about and apply to your situation. These views, don't reflect my employer at Ohio State. Again, they're my thoughts, and we're learning on the fly. I put most of this together on Friday and today, so I think it's fairly up to date. But here's what we know. So there's 325 public school districts in Ohio that are planning on a full-time return to school. There's 55 districts that are going to start remotely, so purely from home. And about 154 public school districts, including about 400,000 students, are going to start in a hybrid model. And that's actually represents what our school district is doing. And I think, the thing that makes a lot of sense to me is if you look at the map of the school districts that are going to start purely virtually, these are places where there's a lot of COVID-19 cases reported. So this slide's from a prior presentation, and certainly, hopefully these are the core tenets as I believe they are. There's 6 things that are going to impact whether we do this and do it well: hand hygiene, universal masking, symptom monitoring, cleaning and disinfection, and physical distancing. I'm going to add one thing to that I hopefully we can all agree at the end of this is very important, and that's community activity. So for better or for worse, whatever's happening in the community is going to go into the schools. And that's why this is so important that that we smash down the curve and limit transmission of the virus in the community, because whatever is going on in the community is going to walk its way into the schools. So this is the data from yesterday. We've had 105,000 confirmed cases. 3,627 confirmed deaths. Again, those are tested patients that died of either cardiac or respiratory issues with COVID-19. If you want to hear kind of my thoughts on how deaths are being reported, I did a fact or fiction video blog most recently, and maybe you can look that one up. I'm not going to spend a lot of time on that. But one of the things that I think is good is if you look at the arrow, our 21-day trend is slightly in the negative. So this is for the state of Ohio. 21 days ago, we reported 1,700 cases, and most recently we reported under 1,000. So the curve is starting to go down, which again is going to be very important for what walks its way into our schools. So these are the areas that are on level 3 or higher. We don't have any level 4. But as the governor has reported, and I certainly agree, if there's very high exposure and spread, it's going to be almost immediate that it's in the schools. So it's important that we look at what the levels are as we open the schools. So you can look at, I just chose to pick Franklin County because that's where I work. And Franklin County, unfortunately, is one of the more um, higher uh, level counties right now in the state. So the thing that I want you to think about is this. So there's 126 cases per 100,000 people in Franklin County. Let's do the math for a minute, and math is not my strong suit, so bear with me. So this school year, there's 366 public schools in Franklin County, and that's almost exactly 200,000 students. So if we know over the last 2 weeks, there's 126, or we'll say 127 cases per 100,000, the math would say that for those 200,000 students, there's going to be about 250 cases in that amount of people. I realize that the math isn't perfect, but I'll show you why I think it's pretty close. So when we open those doors of that 200,000 students, if there's 250 cases, those cases are going to walk right into the building, and then we're going to have a problem. So it's very important what's happening in the community is going to impact the schools. So I want you to think about that when you think about, sending your children back to school. What's your community look like? What county do you live in? So here's some good news. There's fewer cases of COVID-19 reported in children as compared to adults. Children comprise about a fifth of the US population, and only about 7% of the reported cases were in children as of August 3rd. That's the most recent I could find. Now, here's kind of maybe a little bit of the bad news. The number and rate of cases in children have been steadily increasing, and I'll show you that in a graph form. So, and I think this is why the death rate and the hospitalization rates have been steadily decreasing. So if you look at March on your screen, about 40% of cases were 50% of cases were individuals aged 50 to 80. And we already know that individuals in that age group have comorbid conditions that make infection with coronavirus a very life-threatening and dangerous thing. But since June, infections have been in the highest predominance in the age 20 to 29 range, which those are by and large people who are generally healthy and don't have a lot of other comorbid conditions. The problem with this is, if you look at this graph, in July and August, about 40%, 30 to 35% of cases are in ages 0 to 30. And you would surmise that most of the people going back to our elementary and secondary schools are in that age range. Now, there's probably some teachers that are older but by and large, most of the people going back to school are going to be in that age range. So what does that mean? It means that if there's a lot of cases floating around in those age ranges, that a lot of cases are going to walk into the schools. So there's some studies out of South Korea. This is one that made the news, is pretty famous, that children younger than 10 are much less likely to transmit the virus, but children older than 10 transmit at least as well as adults do. So you have to take this for what it's worth. It's a study out of South Korea. It's not the US. We've probably not been nearly as good as South Korea at wearing masks, and we've been a little bit reactionary to these roller coaster waves of cases that we go on. But studies from Asia and Europe also showed similar findings. So again, when I look at my children going back to school and they're in that 8 to 11 age range, I feel a little bit better maybe with sending them back. There's, again, other studies that look at, Iceland, South Korea, Germany, where testing of high-risk groups, adults were much more likely to be positive than children in these studies. Again, we don't know what this is going to look like in the United States, but I will say this: if your children are going back to high school, this same study showed that high school setting found very high levels of positivity among students age 14 or above. So don't take this as all children can go back to school and they're not going to spread the virus around. It appears that there's some data to show that children under the age of 10 don't spread it around as much. But you could also say, do children under the age of 10 get tested as much? Probably not. Another study from just this month, very recent. Most SARS-CoV-2 infections in children less than 18 were asymptomatic. So that's a good thing. But it's also, difficult because if children are asymptomatic, we don't know who's spreading it around. The hospitalization rate is also very low in children. Here's the caveat to this study. Of the children that got hospitalized, 1 in 3 went to the ICU. So, this is what's difficult about this particular virus. I see a lot of things on social media. It's just another flu. It's just another respiratory virus. Well, in certain age groups and certain patients, it certainly is. I will not even argue with that. The problem is we don't know how every single person's going to behave when they get it. And again, in this study, looking at confirmed US cases from March to July, a third of the students that got it went to the pediatric ICU. They did show that prematurity, so children that were born prior to 37 weeks, children with chronic lung disease, and obesity were risk factors for those children that went to the ICU. Something that you have to think about if your children are in those 3 categories, whether you want them exposed. Now, here's the study that is making a lot of, I think, news with college sports. So I'm a huge Buckeyes fan, season ticket holder, and watching intensely as the Big Ten vacillates back and forth about whether there's going to be sports. But this is the study I think that a lot of the experts are looking at. So we knew, and I mentioned this at a prior video blog, that there's cardiac issues that come with COVID-19. Unfortunately, what we don't know is the incidence of that. So myocarditis is an infection of the heart muscle. And it's thought that COVID-19, the virus can either infect the heart muscle or the inflammatory response that the body has inflames and angers the heart muscle. So this study out of Germany that was published in JAMA Cardiology looked at a cohort of 100 patients that had confirmed COVID-19 and did a cardiac MRI of those patients. 78 of the 100 patients, 78%, had MRI evidence of cardiac involvement. And 60 patients, or 60%, had ongoing active cardiac inflammation. We know that myocarditis happens to athletes. I personally know of athletes that have had it. There's people that have been in the news that have missed a season or missed part of a season secondary to myocarditis. It's no joke. It can lead to heart failure. It can lead to cardiac arrhythmias. And we just don't know who's going to get it. We don't know if it's going to be a long-term complication. So, if a prominent college athlete gets coronavirus and gets myocarditis that limits or ends their career, how does that look? So this is what we're studying. And I get it. This is 100 patients out of a study in Germany, but the incidence was much higher than the 17% incidence of cardiac involvement that we saw from Wuhan, China. So I'm just reflecting on the literature. I'm not making a recommendation either way. But if you have a high school or a college athlete that's going back to school, you should think about this in their sports. So universal masking. I discussed this, on prior, just about every video blog. My belief that asymptomatic people can cough and spread the virus. And so masking is very important. I presented this slide at a prior video blog, but if you didn't see that one, it's really indisputable that the Lancet looked at almost 40 studies and showed that there was a 17% chance of transmission with no mask and a 3% chance with a face mask. The doctors and the health experts that we take our children to, the Ohio Children's Hospital Association, the American Academy of Pediatrics Ohio chapter, have supported wearing face coverings. These are the experts. They're reading the literature. They're the people I trust when I take my kids to the doctor. And these are their recommendations. They recommend that children, grades K through 12, wear a mask or a face covering. And the exceptions to that are very few. So those are children under the age of 2, which obviously wouldn't be in a K through 12 school. Any child unable to remove the face mask without assistance, a child with a significant behavioral or psychological issue. So, maybe a child with severe anxiety or a child with autism that has a tactile aversion, a child with a facial deformity that causes airway obstruction. And I love this statement from them because I think it makes a lot of sense. There are no diagnoses that warrant blanket exemptions from wearing a face mask, specifically asthma, allergy, or sinus infections. I showed you the data. Chronic lung disease is one of the underlying conditions that lands kids in the ICU. A third of the kids that got coronavirus that got hospitalized went to the ICU. And one of the underlying conditions is asthma or chronic lung disease. So if your rationale is I'm not going to send my child to school with a mask because they have asthma, it's a very flawed rationale, and you should give it more thought. So again, I think most of the professional societies, most of the literature is saying, please, send your child with face masks. They often don't get symptoms, and so therefore the virus can spread around willy-nilly. This paper I thought was really important, and I love this statement. The use of masks in children is preceded by strong parental work and school lessons on the issue and other hygiene topics, so children can help and know how to wear the mask. So, that's an important thing. So this study made a lot of news recently. This was the study out of Duke that looked at low-cost face coverings and how well they did. And they looked at these 14 different face masks. And I'll draw your eyes to number 11 on this. This is the neck gaiter that's very popular. The neck gaiter, if you look over here on the right of your screen, actually increased viral transmission. Now, I'm not ready, I don't think, to draw the conclusion that neck gaiters always increase viral spread. I heard the author of this study interviewed, and they mentioned that it was a very thin one-layer gaiter that they used in the study. So if you're going to wear a neck gaiter, a couple of things that these are, anecdotes having worn one. They're neck gaiters for a reason. They want to fall down to the neck. And I feel like when I see people with these, a lot of times they're over their mouth, but not over their nose. If you wear this, I would do at least a double layer, if not triple layer, and you got to keep it up over your nose. And there will be more studies on this. So I guess what I'm doing with my children is I'm having them wear a regular surgical or a double or triple layer cloth mask, which you can see on your screen. All these cloth masks performed very well, and instead of the neck gaiter. But my hope is that this study gets replicated at multiple sites and we see that the neck gaiter performs well. I think if it's replicated at multiple sites and the neck gaiter doesn't, then we need to cross that off as an accepted facial covering. Parents, you can do this, okay? So this is a picture of my kids. We recently went to North Carolina on vacation, and this is a picture of them at a beach store. They wanted to go in and get boogie boards. Find a mask that they like. My son really likes this mask that says Warrior on it. Warrior's a hockey brand, and he likes that. Caroline will wear just about anything. She has a sloth mask that she really likes. When they have the mask on, sometimes they want to touch their face. They want to play with it. They want to adjust it. I have to remind them, the more you touch your face, the more you can get the virus on your face. But they've gotten pretty good at wearing the mask. They know to grab it if we go in a store, and we didn't eat out at all inside a restaurant. I haven't been in a restaurant since February. Um, we tried to do the takeout, stay at the beach kind of vacation, but when we went in to get groceries or sunscreen or something like that, they got pretty good at wearing the masks. You have to. This is just like anything else with your kids. I think you have to practice it. They have to get used to it, and once they do, I think we underestimate what our kids can achieve. Physical distancing. Again, this is important, and I saw a lot of discussion about why 1 meter. Well, the Lancet looked at about 40 studies on distance. The shorter the distance, there was about 13% chance of transmission. The further the distance, there was less than 3%. What they showed is a physical distance of more than 1 meter probably results in a large reduction of virus. But 2 meters or 6 feet may decrease the risk of transmission even more. So we've gone with 6 feet, but 1 meter is probably going to really help limit that transmission. So the American Academy of Pediatrics suggests, at least 3 feet apart if students are wearing face masks. Remember that we have multiple tactics to decrease viral transmission. We're not just using one. So if we choose 3 feet and masks on both, on everyone that's in the room, that's going to really help decrease transmission. Now, for those of you that have pre-K children, the masks are tough, and we know that daycares and places where these children reside just spread viruses like crazy. So we have to mitigate viral spread by increasing our ability to do the other things, like hand hygiene, like adult physical distancing, like wearing face covering, spending time outdoors. So I think I have some slides on that, but I'll definitely talk about that. So in elementary school, kids need to wear face coverings. Desks should be 3 to 6 feet apart. Cohort classes to minimize crossover. So if you track cases to one cohort, like the A through L group, you can quarantine one group. Indoor recess would be high risk. So, or having a bunch of people in one space eating, because obviously you can't eat with a mask on. In secondary schools, try to do as much of this outdoors as you can. Eliminate the use of lockers, because that's where people can congregate. I'm going to talk about the Georgia schools and what happened there here in a little bit. As far as cafeterias, you got to have separate lunch periods. You have to space people out, use additional spaces as you can, utilize outdoor space when possible. I mean, in Ohio, September is a beautiful month. Much of October is very nice. If these kids can space outdoors and eat, that's much safer from a ventilation standpoint. So, ventilation matters. I put some pictures up on social media of us outside in North Carolina, and there's a picture of me with my immediate family, and the optics are, well, look at how many people are together. Well, the one time I posted a picture, it was right before Isaias rolled up the coast, and there was about 20-mile-per-hour winds. And if you're outside, there's going to be very low viral transmission there. The picture on the right of the screen is a restaurant in Wuhan, China, that made a lot of the literature. So there was an index case, which is A1 on your screen, and there was an air conditioner pointed across this tiny little restaurant with the index case who had coronavirus, and every person with a circle was infected in that restaurant. I put this up to illustrate the point that the ventilation in your school might be very different. So our schools have been sending out updates, and actually one of the updates talked all about their ventilation filters and the airflow in the school, which is actually important. So, for better or for worse, some of the school buildings in certain school districts might be very old, might have poor ventilation. That's going to be higher risk than a newer building with better airflow filters, all those things. So these are things that you have to think about. Symptom monitoring, and not just fevers, because remember, elementary school age children are very often asymptomatic, but we know that as many as 40% of viral spreaders are asymptomatic. So you have to keep your kids home if they have symptoms. And I'm saying symptoms, not just fever. These children often don't get a fever. So just checking everyone's temperature as they walk in is not going to be foolproof in this population. We have to ask, are they having cough? Are they having a lack of taste or smell? Are they having, again, fever, shortness of breath, those kinds of things? And if they are, we gotta keep our kids home. Children and testing. So we should test children if they have signs or symptoms of COVID-19 and have had close contact with somebody. So schools need to monitor if there's a case in the household. If somebody in that household tests positive for coronavirus, those children should not be in school and they should not be out, spreading the virus, because we know that children are often asymptomatic, and we can assume that if there's one case in the house that it's going to get spread around. So in most cases, just be ready. If someone in the household gets COVID-19, you can expect, based on different policies, for your children to be out 10 to 14 days of school, which in a hybrid model means they may only miss 2 days or 4 days, but they still need to be held out so the virus doesn't get passed around. So how do we talk to our children about this? I mean, it's scary. I feel like at this point we've probably all been talking to our children about COVID-19 since the month of March, but look for signs of stress and anxiety. Again, don't let the first day of school be the first day that your child wore a mask. If they're playing sports, they're wearing a mask to the field, they're wearing a mask all the time until they actually play the sport. Look for stress and anxiety. Every child's going to handle this differently. I think there needs to certainly be a video blog on mental illness and COVID-19. It's a huge issue, so I'm not going to dig into it here. But as parents, we certainly have to look for that. So what went wrong in Georgia? So this made a lot of news, and I think we can use this as a case study to illustrate what not to do. So first of all, I talked about community spread, so I'm going to wrap up with this. So I'm trying to bring it all home to you. If there's high community spread, the schools are not going to be immune. Whatever's in the community is going to walk right into the school or the church or the restaurant or the bar. So what we do in those spaces impacts whether we can send our kids to school or not. So this is from Johns Hopkins. This is raw data and tracking, and what's in dark red on the screen is where there's high community spread. So if you look at the state of Georgia, it's very deep dark red. So they opened their schools with high community spread. Then what happened? They didn't have universal masking. Masks were quote unquote recommended. So this is the picture from North Pauling High School in Georgia. You could see on your screen. I personally, I think maybe there's one student where you look behind his ears, maybe you can see the back of a mask. I don't see another person there. Poor ventilation, no physical distancing, no universal masking. We don't know what hygiene was like, but this was a recipe for disaster. So no mask mandate, high community spread, obviously no social distancing. And so what you have now is what's called a cluster. This isn't an outbreak, it's a cluster of 59 confirmed cases of the virus. And I had a friend say on social media, somebody posted this and said, well, 59 cases, but the school district has an enrollment of 42,000 people, so that's less than 1%. The problem is this. The denominator is not the number of students. The denominator is the number of people tested. And I couldn't find anywhere, and somebody probably will know this number and will post it under this, the number of people tested. So it's 59 over the number of people tested is the positivity rate. It's not 59 over 42,000. I know we wouldn't be able to test 42,000 people in a matter of days, here in Columbus. We do 300 to 600 tests within our health system per day, but we can't get to 42,000. There's not enough lab techs. There's not enough reagent. There's not enough testing supplies. it's more than just a swab, right? It's all the other things that go into that. So here's what I'll wrap up. Community activity is going to impact whether we go to school or not. And I love young people. I wish I was still one. But bars closing at 10 p.m., people have a big problem with. And it may seem like a separate issue than sending your kids to school. But we know at bars, people don't wear masks because they drink, and you can't drink through a mask. And we know people congregate and get close, and there's very little physical distance. So closing a bar at 10 p.m. may seem like a totally separate issue. But we also know that the age 20 to 29 age group is the group that has the highest incidence of cases. And that's also probably a lot of our parents and teachers. So the cases in the community are going to get into the schools if we don't decrease community spread. So wear your mask, stay apart, stay outside if you can. Mass behavior is modeled just like everything we do as parents. So if you're a parent who says, I will not wear a mask, I don't believe in it, or whatever the rationale is, that behavior is going to be modeled in children. And my hope is that children who don't wear masks, given the reasons I mentioned with asymptomatic viral spread, are corrected on that behavior while they're in school. Columbus Medical Association recently had a really good blog on the importance of vaccinating your child. This year is more important than ever, because if they get influenza, or if they get rhinovirus or other cold viruses that cause a lot of congestion and coughing, they're not going to be able to go to school, because we're not going to be able to differentiate whether this is a cold virus or coronavirus. And I can tell you that the school nurse is going to keep that student home. So get your kids vaccinated. It's very important if you want to send them to school. Comorbidities still matter. I said children are much less likely to get hospitalized, but in the ones that do, a third went to the ICU. And we mentioned lung disease, prematurity, and obesity as three of the important school factors. Space is at a premium when it comes to social distancing, right? I don't know, where your school is, but ours are already very crowded. So if they're already very crowded, then we have a problem, and that's why this hybrid model exists. Opt-outs are important. So everyone's decision is their decision. And for the parents that are able to homeschool their children and opt out of sending their child to school, that actually helps the parents that are going to send their children to school, because there's less bodies there. The physical ventilation of the building matters. And staying home may be the safest choice. So, I'm going to wrap up, and I'll give you my opinion as of August 20th at 11:20 a.m. We've decided that we're going to send our children to school. We have a hybrid model. I've gotten a lot of the updates. I feel pretty confident in what our school district is doing. But also I recognize that this is not the safest choice. The safest choice is to stay home and keep your kids home. The problem is March through May, we had a really rocky experience with homeschooling. I work, my wife works. We had a hard time finding where the assignments were. It was really just rough, especially for my son who's entering second grade. But also, we reserve the right to see how it goes and maybe decide on homeschooling. If I hear from my children that nobody's wearing a mask and it's not being enforced, then I'll probably reach out to the school first, but second, realize that my kids aren't necessarily safe there. Also, my parents are elderly, my in-laws are elderly. We probably won't be able to see them as much once the kids start school, because there's an additional layer of risk that has entered our household. And that's something that you have to think about as well. And if we do, we're going to do it the way we've been doing it. And that's outside, on the patio, try to be as safe as you can. But those are things that you have to think about. And again, this is a very personal decision, and hopefully we don't judge, other parents for what they're doing. But I would say, in sum, universal masking, physical distancing, hygiene, cleaning, disinfection, ventilation, and what's going on in the community is what's going to dictate whether this goes well or not. So those are kind of my thoughts. I really want us to get better at COVID-19, at wearing masks and at spreading it, because I want to go watch the Buckeyes in the shoe and, be able to do some of the things that we used to do, like eat in a restaurant and things like that. But so I want to thank Columbus Medical Association for letting me do this. Again, this was a little bit longer one, but a lot to cover. And you guys know how to reach me on Twitter or Facebook if you have any questions. Thanks.